Hi, my name is Anisha Basu. I'm going to be a senior at Hudson High School in the fall. This summer, I worked in Marymount's Rehabilitation Services Department in the Cleveland Clinic Science Internship Program. This summer, my project was the effects of anesthesia on pain levels and ambulation distance in post-operative total knee arthroplasty patients, a retrospective study. Total knee arthroplasty is also known as a total knee replacement. In this procedure, the surgeon completely replaces the knee joint by removing damaged cartilage and bone and replacing them with a man-made surface of metal and plastic. The causes for this surgery could be inflammation from arthritis or an injury, or a complication from a previous injury. Side effects include scarring, blood clots, and rarely infections, and usually include post-operative pain. The recovery period is about 6 weeks or longer and usually consists of about 3 days in the hospital and up to 6 weeks or longer of rehabilitation. Post-operative pain is managed with the use of physical rehabilitation and pain-relieving medication. The procedure is usually conducted under general anesthesia with nerve blocks, usually sciatic lumbar plexus blocks or sciatic femoral nerve blocks. What happens in the surgery is the surgeon goes in and will cut away the bottom of the femur and replace that with a titanium femoral component. The surgeon will also cut away the top of the tibia bone and replace that with another titanium component. During the procedure, the meniscus is also removed and replaced with a polyethylene plastic surface. Usually, the back of the patella is also scraped away and replaced with another plastic surface. So what are we studying? We're studying the effects of different combinations of anesthesia and painkillers on the effectiveness of total knee arthroplasty. We're studying this to improve the effectiveness of the surgery and to increase the average distance traveled after surgery. The results from this study can reduce the amount of time it takes patients to get back to their level of mobility before the surgery. We hypothesize that certain anesthetic medications will directly affect the pain levels and distance of ambulation on post-operative total knee arthroplasty patients. Patients were observed post-operatively during their acute care stay. We observed their ambulation distances, pain levels, and the pain medications that they were given. During the 6 weeks of data collection, data was collected via physical and occupational therapist notes and medical record review. For data analysis, we averaged pain levels and ambulation distances for post-operative days 1, 2, and 3. The Wong-Baker pain scale was used to obtain patient pain levels. In this pain scale, the pain is rated on a scale from 0 to 10, with 10 being the most pain and 0 being no pain. We collected data on the type of anesthesia that a patient was given during the procedure and found that a majority of patients receiving total knee replacements received a lumbar plexus block. That would be 54%. 32% of patients received a femoral nerve block, and only 14% had the procedure with only general anesthesia. The postoperative pain medications that patients were given were pretty varied. The most common drugs prescribed were Percocet and morphine. Percocet had about 30% patient use, and morphine had about 27%. It was interesting to see that only 12 out of the 59 patients in the study were male and 47 were female. 3% of the patients in the study had bilateral knee replacements, meaning they had both knees replaced at the same time, while the majority had just unilateral. The average distance walked post-operatively. Patients with a lumbar block steadily increased their ambulation distance, but those with femoral blocks had a higher final distance. For day 1, most of the patients had a walking distance of about 3 feet. Patients with a lumbar plexus block ambulated on average 3.87 feet, those with a femoral nerve block ambulated on average 3.68 feet, and those with just general anesthesia ambulated 3.25 feet. By post-op day 2, remarkable differences of the effects of anesthesia began to emerge. Patients with a lumbar block ambulated 34.36 feet, those with a femoral block ambulated 22.62 feet, and general anesthesia patients averaged 37.71 feet. By post-op day 3, femoral nerve block patients ambulated on average 79.6 feet, lumbar block patients ambulated approximately 62.5 feet, and general anesthesia patients ambulated 54.1 feet. Now, if we look at pain, it's interesting to see that those with general anesthesia ended up with lower pain, although they had the highest levels of pain on day 1. On day 1, patients who received a femoral nerve block on average reported pain levels of about 4.26. Those with lumbar plexus blocks reported pain levels of about 5.42, and general anesthesia patients had pain of 5.6. During post-op day 2, patients who were administered blocks on average reported a sharp increase in pain, and we hypothesized that this was because by day 2 the nerve blocks had started to wear off, and patients who had received those were starting to feel the pain. Although patients who received general anesthesia reported a decrease in pain levels from 4.14 on post-op day 2 to 2.3 on post-op day 3, it was interesting to see that by day 3, patients with a lumbar plexus block reported pain of about 3.7, while patients with femoral blocks complained of pain levels of 4.56 on average. We hypothesized that those with general anesthesia reported higher pain levels on day 1 because they didn't have a nerve block, but their pain levels dropped on day 2 and day 3 because they had built up a tolerance to the pain. This study has shown that there is a correlation between the type of anesthesia used during the procedure and the distance a patient is able to ambulate after surgery. In this study, the femoral nerve block is the most effective type of anesthesia for total knee replacement patients. These patients were able to ambulate farther distances after the procedure. This study has also shown that there is a positive correlation between general anesthesia and pain levels postoperatively. On average, the pain levels for these patients decreased steadily over their 3-day stay. It would be interesting to see if those patients with general anesthesia were able to catch up in rehabilitation with the femoral nerve block patients who had higher ambulation distances. This study should be completed over the entire rehabilitation process, following patients through their acute care stay as well as post-acute care facility. Also, determine if a correlation exists between the physical or occupational therapist treatment plan and patient ambulation distances. In addition, there are a large volume of studies in the field on total knee arthroplasty's correlation with range of motion. A further study should be conducted in order to determine if there is a correlation between total knee arthroplasties and ambulation distances. I want to thank everyone in my department at Marymount Hospital, and special thanks to my mentor, Marianne Douglas, and my co-mentor, Mike Padley. I also want to thank some physical therapists and doctors that helped me with my project: Ashley Kermediak, Kathy Likozar-Cup, Jesse Hale, and Dr. Britton Scheuer. I also want to thank the Cleveland Clinic Office of Civic Education Initiatives and everyone at Marymount Hospital. Thank you.